as we all know that the endovascular thrombectomy has been demonstrated to be the most effective therapies for patients for acute ischemic stroke patients secondary to large vessel occlusion. And in all over the world, the endovascular thrombectomy has been widely used in clinical practice. But we can also encounter a lot of unfavorable functional outcomes in patients. And the study has demonstrated that it's about the mortality of these part of patients is about 15 to 20% in the 90 days, and the functional dividends rate is about 40 to 50%. So how to further improve the functional outcomes of patients who achieved endovascular thrombectomy has been investigated, and has also been gained attention in the field of acute ischemic stroke. And during the past years, a lot of researchers and clinical physicians has found that neuroprotective drugs and strategies, and in combination with endovascular thrombectomy, may be a promising therapy to further improve the functional outcome of the patients who achieved endovascular thrombectomy. And in our group, we research the neuroprotective effects of remote ischemic conditioning, and we found that the neuroprotective or the cerebral protective of remote ischemic conditioning has been significantly, and in our pilot study of remote ischemic conditioning in patients who were treated with endovascular thrombectomy, we found that both bilateral upper limb occlusion didn't significantly influence the cerebral high dynamics, or it also didn't influence the intracranial pressure. So based on our previous preclinical and clinical pilot study, and now we are conducting a multi-center clinical trial in China, and the trial is RECAST-MT. And in this trial, we want to investigate and to determine the safety and efficacy of remote ischemic conditioning in patients with anterior circulation acute ischemic stroke who were treated with endovascular thrombectomy within 24 hours. And in this study, we have two main goals. The first is to determine the efficacy of remote ischemic conditioning, and the other aim is to determine whether 2 weeks of remote ischemic 2 weeks of remote ischemic conditioning treatment is as effective as 1 month remote ischemic conditioning treatments. So in this study, we designed 3 groups. One group is a control group, and in this group, patients will receive endovascular thrombectomy alone, and there are also 2 other groups. One group received 40 days of remote. One group received 14 days of remote ischemic conditioning treatment, and the other group received 30 days remote ischemic conditioning treatments. And different with other similar studies that investigate remote ischemic conditioning in patient who received intravenous thrombectomy. And in the RECAST-MT study, we initiate remote ischemic conditioning before the treatment of intravenous thrombectomy, and in combination with intravenous thrombectomy, so the main difference between our study and a previous study maybe located in our study performed remote ischemic conditioning before the blood vessel was recanalized. This may be a more important target that for the cerebral protection, that before the vessel was recanalized, and neuroprotection may slow down the co-infection progress and protective to preserve or frozen much more penumbra, and which can pave the way for endovascular thrombectomy. And now the study has been begun, and we have recruited about 100 patients in China, and we hope that the study can be complete its recruitment in the following 2 years, which will recruit patients about 2,100 participants in China.